Why do some illegal immigrants seem to get free housing, health care, and legal protection, while struggling American citizens are left behind? What you're about to hear isn't conspiracy. It's reality, backed by facts that are hard to ignore. In recent years, growing frustration has emerged across American communities, from veterans sleeping on the streets to working-class families struggling with inflation and medical bills. Because while they face these hardships, stories keep surfacing about illegal immigrants receiving taxpayer-funded benefits. This frustration isn't just emotional, it's rooted in data, law, and political decisions that have been building for decades. And understanding how we got here requires tracing the legal, social, and economic mechanisms that create this perception, sometimes this reality, of more rights for illegal immigrants than for U.S. citizens. Let's start with housing. In cities like New York, Los Angeles, and Chicago, illegal immigrants have been placed in hotels, sometimes costing hundreds of dollars per night, funded by public programs. While technically these benefits come through emergency shelters or municipal aid, the reality is that U.S. citizens, even those in dire need, often face long waiting lists, bureaucratic delays, and eligibility barriers. For example, in New York City, the right to shelter law has long guaranteed housing to anyone who needs it. That includes undocumented migrants. While legal residents have to prove need, income levels, or face eviction before qualifying, thousands of illegal immigrants have been directly bussed in and housed within days. The optics are startling. A veteran waiting months for a housing voucher, while a new arrival receives hotel placement within 48 hours. This is not just anecdotal. Federal and state-funded programs, especially in so-called sanctuary cities, have blurred the line between emergency aid and permanent support. A report from the Office of the New York City Comptroller noted that over $1 billion had been spent in a single year on migrant services, much of it allocated without long-term budgeting plans. Meanwhile, shelters for homeless citizens remain underfunded, overcapacity, and undermaintained. The frustration among residents is not just emotional, it is empirical. Healthcare is another hot-button issue. Under the Emergency Medical Treatment and Labor Act, hospitals are required to treat anyone who comes through the ER, regardless of immigration status or ability to pay. While that's a moral imperative, the consequences have ripple effects. Many illegal immigrants use emergency rooms as their primary care, which places financial strain on hospitals, especially public ones, leading to closures, reduced staff, and overworked medical personnel. These conditions don't only affect migrants, they affect all patients, including tax-paying citizens. But there's more. Several states, like California and Illinois, have passed laws that explicitly provide health coverage for undocumented immigrants using taxpayer funds. For example, California's Medi-Cal now covers undocumented individuals up to age 26, with a planned expansion to older adults. Meanwhile, a middle-class American family may be paying sky-high premiums, deductibles, and co-pays. Even those with insurance sometimes delay medical treatment due to costs. It's not that undocumented immigrants are stealing care. It's that the system creates two vastly different experiences for people in the same hospitals, under the same roof. And then comes the legal system. One of the most misunderstood areas is how undocumented individuals can access legal protection. While citizens often face the criminal justice system alone, unless they can afford a lawyer, many illegal immigrants benefit from advocacy groups and legal nonprofits, funded through grants and donations, some of which receive government support. In cities like San Francisco and Denver, these programs are fully subsidized by taxpayers. Illegal immigrants detained for deportation often receive free legal counsel, interpreters, and housing assistance, while U.S. citizens facing eviction, criminal charges, or custody battles might have to navigate the system without any help unless they meet extremely narrow income guidelines. The gap gets even wider when we look at the legal penalties themselves. In some cases, undocumented immigrants are given leniency not available to citizens. For instance, in sanctuary jurisdictions, local authorities are restricted from cooperating with ICE, even if someone has committed a crime, based on the idea that immigration enforcement undermines community trust. This means that while a U.S. citizen might face full prosecution for the same offense, an undocumented individual could be shielded from federal consequences. These inconsistencies have triggered public outcry, especially from victims of crimes committed by individuals who were previously flagged by immigration authorities but never deported due to local non-cooperation policies. At this point, it's not hard to understand why many Americans feel abandoned. The narrative that illegal immigrants have more rights isn't entirely false, but it's also not that simple. What's really happening is a combination of laws, court rulings, and policies that create parallel systems. One is slow, restrictive, and underfunded, the one that serves struggling American citizens. The other is streamlined, heavily advocated for, and protected by overlapping layers of legal and political pressure, the one that increasingly benefits undocumented immigrants. To make matters worse, the political climate has polarized the issue. Instead of nuanced discussion, we hear slogans. If you question why your tax dollars fund housing for illegal immigrants while veterans sleep in tents, you might be labeled xenophobic. If you suggest more humane treatment for undocumented families, you're seen as soft on border security. This toxic environment blocks honest conversation and long-term solutions. But the truth remains, many illegal immigrants receive essential services at a level that struggling citizens don't. This isn't always because they're prioritized, but because advocacy for them is louder, better funded, and more legally protected. This trend isn't just happening in border states. It's becoming a national issue. And the people who feel it the most aren't the loudest voices in politics. They're the Americans quietly working two jobs, skipping doctor visits, and living paycheck to paycheck. It started in the early 1980s with the Supreme Court ruling in Pleyler-Verdot. The court decided that states could not deny public education to children based on their immigration status. That landmark ruling set a precedent that access to publicly funded services couldn't be limited solely based on legal status, at least not in all cases. It wasn't about special treatment, it was about rights, but it created a slippery slope. Over time, the same logic began to apply to other public services: emergency medical care, legal defense in immigration proceedings, and eventually even subsidized housing in sanctuary cities. In the following decades, especially in the late 90s and early 2000s, immigration advocates became highly organized. Nonprofit legal groups, church networks, and city councils began passing ordinances to restrict cooperation with federal immigration enforcement. These were pitched as humanitarian protections, but the result was a growing divide in how laws were enforced. Local police could no longer share information with ICE in many areas, and this gave rise to the now common idea that undocumented individuals were, in some places, effectively shielded from federal law. The federal government's role can't be ignored either. Executive orders signed by multiple presidents across both parties have expanded protections. For example, the Deferred Action for Childhood Arrivals, or DACA program, introduced in 2012, granted work permits and temporary protection from deportation to hundreds of thousands of undocumented immigrants who arrived as minors. Though it offered no path to citizenship, it did allow access to jobs, driver's licenses, and in some states, in-state tuition, benefits often out of reach for struggling American citizens. Even during periods of increased immigration enforcement, federal budgets kept allocating billions in funding for immigration courts, shelters, and social services for undocumented individuals. At the same time, funding for public housing and mental health care for citizens was slashed. Ironically, systems designed to handle humanitarian crises at the border have now been repurposed to manage long-term social needs, creating a shadow welfare system running parallel to the one that American citizens rely on. What's rarely talked about is how eligibility works. For instance, undocumented immigrants may not qualify for federal welfare programs like SNAP or Medicaid. But in practice, many still receive aid through emergency clauses, state-level initiatives, or through their U.S.-born children. A single undocumented parent with 3 citizen children might legally qualify for a variety of benefits, including housing assistance, school meal programs, and health care for their kids. Meanwhile, a single unemployed American adult with no dependents might receive nothing. This creates real resentment, especially in areas already strained by high costs of living. In cities like Los Angeles, longtime residents are watching resources they paid into for decades redirected toward recent arrivals. Public school classrooms are overcrowded, hospitals are overwhelmed, and rents are skyrocketing. While none of these issues are caused only by illegal immigration, the perception is shaped by daily reality, and perception often becomes political fuel. Now add to that the fact that undocumented immigrants are often heavily supported by advocacy infrastructure, legal defense funds, sanctuary policies, religious aid networks, language translation services. These supports are widespread, organized, and often taxpayer-funded. In contrast, many struggling citizens, especially working-class white, Black, and Latino Americans, lack the same kind of advocacy, visibility, or coordinated help. The narrative that illegal immigrants have more rights doesn't hold up in a legal textbook, but it makes sense when you look at how the system functions in practice. One group gets immediate shelter, access to courts, and organized legal defense. The other gets wait-lists, bureaucracy, and closed doors. Not because one group is more deserving, but because the structures supporting them are different, and the loudest voices often aren't the ones speaking for ordinary citizens. This tension isn't going away. As more migrants arrive at the southern border and get bussed into major cities, more Americans will feel the pressure, and more divisions will grow. Without structural reform, it's likely that resentment will deepen, and both immigrants and citizens will continue to suffer in a broken, overburdened system. So here's the question we all need to ask. What happens to a nation when citizens feel like outsiders in their own country, while newcomers are treated as the priority? If this breakdown shocked you or made you think differently, don't scroll away. Subscribe to the channel so you don't miss the next episode. We're going to break down exactly how immigration courts work, who pays for them, and why enforcement has become almost impossible in some states. And let us know in the comments. Do you think the system is broken beyond repair, or can it be fixed with the right leadership?